Welcome to all the BU SPH alumni and guests. It's great to see you here. It is wonderful to see such an exciting crowd and such an engaged group here in Chicago. Welcome to my hometown. My name is Robin Sterling Eckerling, and I am a 2006 BU SPH alum. To say that I'm proud of my Boston University School of Public Health roots is really an understatement. The education that I received, as well as the nurturing environment that was fostered by the professors, gave me the courage and knowledge to push forward in my career. First with the United States Department of Health and Human Services, then to big law, and now, well, I realize we're at public health, but now as in-house counsel for a multi-billion-dollar corporation. I serve as the HIPAA privacy expert. The education that I received helped me think about and solve my clients' health law problems in a well-rounded and complete manner. I feel that the Boston University School of Public Health prepared me for whatever legal issues may come my way. And so BU holds a very, very special place in my heart. When I moved to Boston, my parents kept asking me after I received my law degree, why did you go to Boston? Why are you getting this extra degree? And I can't even tell you how every day I think about Boston University School of Public Health and how grateful I am that I made the decision to get on a plane and fly to Boston and attend BU. It was a decision that ultimately changed my life for the better. And I can't tell you how much the alumni, the professors, and the school changed my life. But I want to tell one anecdote about the dedication that the professors have to their students, whether during their tenure, during their time at school, and even after when you're an alumni. So one quick anecdote, and then we can get to the main event. It's just a quick story, like I said, that I think exemplifies how dedicated the BU professors are. I found myself in Las Vegas. I was on vacation with some friends, and I had a big job interview coming up. It was for a job that I really wanted, and truthfully, I was terrified about the interview. Absolutely terrified. But it just so happened that one professor, Leonard Glantz, happened to be on vacation in Las Vegas. I know that many of you may find that shocking. And as a matter of fact, he met with me in a Las Vegas bar for an hour and prepped me for that interview. And by the way, the best interview prep location that I could recommend for anybody. So looking back on it, truthfully, Leonard's questions were actually harder than the questions that I got during the interview. And in case anyone was curious, yes, I did get the job, and it was the job that brought me back to Chicago. I was, and I'm still eternally grateful for that time and that experience. I could go on and on about stories. Even though she's not here tonight, Wendy Mariner and I spent a Valentine's Day in Washington, D.C. I mean, I just, the time and the dedication was phenomenal. But I could go on and on about everyone in the health law department and then all the other professors at the school as well. But I think that you get the picture. Boston University School of Public Health and its professors hold a very special place in my heart. And needless to say, it is the reason that I'm so honored to be here tonight and to introduce the Dean of the School of Public Health, Dr. Sandro Galea. I'm thrilled with his visions of the School of Public Health, and I think that with him at the helm, we have a very, very bright future. So he's a man that doesn't need an introduction, but I'm going to do it anyway. So as you know, he assumed the position on January 1st, 2015. Prior coming to BU, he was I practiced this a couple times, I'm still going to screw it up, the Anna Cheskis Gelman and Murray Charles Gelman Professor and Chair of the Department of Epidemiology at Columbia University's Mailman School of Public Health. In 2006, he was named one of Time Magazine's Epidemiology Innovators. Dean Galea has published more than 500 scientific journal articles, 50 book chapters and commentaries, and 9 books. He is the past president of the Society of See, also a word I practiced and I'm not getting. But so I'm just going to say Society for Epidemiology Research, an elected member of the American Epidemiology Society, of the Institute of Medicine, and the National Academy of Sciences. So a lot of accomplishments in some really big organizations that I can't pronounce. That being said, I am incredibly honored to introduce to you Dean Sandro Galea.
Thank you very much, Robin, for those kind words. And thank you, everybody, for being here. It's really fantastic. I think this event is really one of the highlights of the year. Last year, when was before I had started, I had the privilege of going to the event in New Orleans, which I thought was really phenomenal. It was in an art gallery, for those of you who were there. And I thought, how will we top it this year? But we have. This is just spectacular. It really is. Now, next year, it's in Denver. And I'm not sure what we're going to do there, but we hope you'll join us. Moving right along. So let me tell you a little bit about the school. We have an amazing school of public health. It's when I was auditioning for this job, somebody said this school is the best kept secret in public health. And they were absolutely right. And of course, the part that we're trying to change is making sure it's no longer a secret. In the past year, it ascended as appropriate to be one of the 10 best schools of public health in the world, which was I think, long overdue and really a reflection of how fantastic the school is, how fantastic the school community is, including alumni, faculty, staff, and students. So let me tell you a couple of things about your school, and just give you some numbers, and then I want to tell you what we're doing with the school and where we're headed over the next couple of years. So the school is, we have about 250 faculty. About 160 of those are full-time and primary. We have about 250 staff, now about 1,100 students from about 50 countries. So for those of you who remember the school as small and quaint, we're still quaint, but we're not small. Our students have changed dramatically. Our modal student age is about 25, 26. 87% of our students are full-time students. That is a different world than it was 10, 15 years ago. We are, our students are, more than 90% of our students are employed in public health and area of their choice 6 months after graduation, which is really a lovely testament to the strength of our students and the work of our educational folks and our career services folks. So we have fantastic students, faculty, staff, alumni. Where are we going with this? There are 3 big areas we're working on, and everything we're doing is really, we're thinking of it in the areas of research, education, and translation. So a few things about each one. Starting with research, under the leadership of our Dean of Research and Faculty Advancement, Mike McLean, who's here today, we are implementing a whole host of programs to support our faculty. We are bringing on new faculty. We have brought on 9 new faculty this year, some really outstanding people who I hope you'll all meet over time. We are currently looking to hire 2 chairs of departments, Chair of Global Health and the Chair of Health Law Policy and Management. If interested, we have applications over here. And we anticipate both the Health Law Policy Management Department and the Global Health Department to grow and thrive and to really become what they should be, which is the world-leading departments in their respective areas. That's a quick snapshot on research. On education, we are launching a brand new MPH in the fall of 2016. It's going to be an exciting MPH for any of you who saw our booth at at APHA, which, by the way, won an award for the best booth, which we're very proud of. We didn't realize there was an award for best booth. Nobody told us there was such an award, but once we found out there was an award, we wanted to make sure we won it. It changed everything. The MPH, which is launching in the fall of 16 under the leadership of Dean Lisa Sullivan, our Dean of Education, who's also here, is a really groundbreaking transdisciplinary degree that is going to prepare our students for the world that they're facing, prepare our students for a changing world. It will have interdisciplinary certificates, a common core, and an immersion in professional development, practical education from day one. That's launching in the fall of 16. In the fall of 17, we will be launching a suite, a handful of new Masters of Science programs, which will be 1-year-long programs. It was the Masters of Science that does it every time. I think somebody opened the stairs, that's all. There we go. Having reconsidered, we are not launching Masters of Science programs in fall of 17. We will be launching Masters of Science programs in the fall of 17. I'm telling you, every time I say that. Moving right along. We are also in 16-17 launching lifelong educational programs. We currently have no real set of programs that are some for credit, some not for credit, some digital, some in person, some weekends, some evenings, which would allow principally alumni to continue taking courses in the school, to remain connected with the school, and to really make their educational experience something that can go on throughout their life. So all of that's happening in the next couple of years. This is in education. In practice and translation, we have an outstanding practice group. We are launching a public health activist lab in the beginning of 16, which is intended to be really the tip of the spear about how we as a school intersect with our core mission, which is to create healthier populations. We've been grappling with what is it that we do as a school, how is it that we fulfill our responsibility to create a healthier world, and that we do so in a way that is consistent with our academic identity. That's going to be launching in the beginning of 16. The other thing that's going to be launching in the beginning of 16 is our Public Health Post, which is a digital space where we will want to make sure that the ideas of public health are out in the public conversation, where we can inflect and move the public conversation so that health is seen as principally public health, not the way it's mostly seen today, which is principally a function of medicine. So you're going to see those coming out in the next year. So we have a lot of exciting things going on, and none of this would be possible without our whole community of faculty, staff, students, and alumni. I want to say thank you. I've been extraordinarily impressed since I've joined the school by how vibrant and engaged the alumni community is. Many times alumni say, how can I help? We're always looking for alumni to host practica and to have job openings for our career services. If you have any such opportunities, make sure you let our alumni relations folks know. You'll have seen on the table small cards about STAMP. STAMP is our Students Alumni Mentoring Program, which is launching in the fall of 16. The concept is very simple, that we aim to pair every incoming student with an alumna so that to create mentoring pairs. It's a simple idea, one that other places have done in other contexts, although we haven't seen it in public health, and we don't see why not. And we've had a lot of alumni who say they would like to do this. We have a lot of students who want to do this. All we need is to make sure that we have the alumni sign up. So there's a simple sign up. There are cards on the tables, and talk to our alumni office on doing that. The other thing that we have sent around is we've created an annual school survey where we survey our whole school community. Again, alumni, students, staff, and faculty. The deadline closes November 16th. Everybody here is over-surveyed, but really, the school has never surveyed you. So we want to know what you think. You want to tell us what you think. So really, it's like our incentives are aligned. All you have to do is you have to go on, and if you say everything's great, it takes only 5 minutes. If you have things that you don't like, then it takes a little bit longer. I'm not swaying you, but there are also cards about the school survey floating around, and it will close the next couple of weeks, and we will report back what you're thinking. And our intention is to do the survey every year, obviously, so we can see how we're doing over time. The bottom line is that there's an extraordinary amount of things happening at the school. We have spent the past year aspiring to build on what is an outstanding school to make it ever better. And I feel like we can do that. I actually think we can do it. I think we have the ingredients in place to create a school that's even better, that really represents us all well, that makes you, all the alumni, proud, makes all of us who are part of the school community proud. Because we can be a school that is dedicated to producing top-tier research, but deeply committed to the education in public health and to the practice of public health. That is who we are, and that is who we're going to be going forward. Thank you. So thank you all for being here. Now, we are moving on to the heart of the program today, which is to present our Distinguished Alumni Awards. So we have honored alumni since 1989, and we honor alumni who are made outstanding contributions and who exemplify dedication to public health, local, nationally, and globally. And something that's really cool is that first person to actually get a Distinguished Alumni Award is here today. And so I'm particularly fond of this particular alumnus because he is the Director of Public Health Department in my town of Brookline. That's Alan Balsam, who is right there. So Alan, I tell my kids that I know the guy who keeps us healthy. And there's nothing else I do which impresses my kids, but that impresses them. They're like, whoa, you know the guy. So Alan has been a school faculty member, a loyal school supporter, and most importantly, it was his birthday over the weekend. May I ask us all to sing Happy Birthday to Alan very quickly before we start? Happy birthday to you. Happy birthday to you. Happy birthday, dear Alan. Happy birthday to you. Now, what the other new Distinguished Alumni Award recipients need to know is that we will also sing for your birthday every year now from now on. So let me start with our first award winner. Now, this is also whistling. Okay. Can you hear me okay? No? Yes? Okay. All right. So we're going to start with Vivian Cabral. And I am so thrilled to honor these three alumni because, as you'll hear in a second, these are three extraordinary people who have all done really different things, and I think who have all really realized the promise of what it means to be a graduate of a school of public health. They really have all tackled public health from multiple angles, and they have really given real life to the notion of working across sectors to improve the health of populations. So, let me start with Vivian Cabral. So Vivian is a consultant at the Los Angeles Economic Development Corporation, where she helps position them as a thought leader in innovation. Before that, she was a prize manager at the X Prize Foundation, which is an educational nonprofit organization with a mission to bring about radical breakthroughs through incentivizing competition. She led healthcare communications teams, managing successful marketing projects at various organizations, including Edelman, Biogen, the George Foundation, and Pfizer, where she launched Pfizer's smoking cessation program. She has taken her public health degree to project management communications and has worked in these enormous large companies to create a world with better health. She graduated from us with an MPH in health services, as well as having degrees from Columbia University and University of Michigan. I often think that, Vivian, what you have done is really a path that many of our students today want to follow, and from you I think they draw inspiration. Vivian, come on up.
Well, thank you very much, Dean Galea, and thank you also to Michael O'Brien, who I think is also somewhere here in the audience, the staff at BU, SPH, and my amazing professors and classmates. This award is very special to me for more reasons than are obvious. I attended BU in the late 90s with my brother John. He was also doing a dual degree in medicine and public health. And as typical with siblings, we were pretty competitive about who was the most distinguished kid in the family. So Dean Galea, thank you for finally settling the debate. The text I got when he read the newsletter was, "Wait, what?" So I am deeply honored to receive this award and very proud to be an alumni of BU. My education here was really invaluable, and it really showed me how I could really unleash my own potential, and it instilled in me the public health values that I carry with me in my career and also in my personal life. And I want to also express appreciation and gratitude to my family, who aren't with me today, but I just wanted to give them a shout out because my parents were really the first true examples of public health practitioners. And I inherited their desire to change the world to be a better place and a healthier place for all of us to live. And finally, I just wanted to take a moment to say that our healthcare system is ripe for a big disruption. And I'm just waiting for someone in this room to be the founder of Uber or Twitter of public health. And I really think that the demand for better care, needing to make it affordable, accessibility, wanting a cleaner environment and better health is really why we all do this, and it is happening right now. So I look forward to hearing about what all you guys are doing and how you're innovating in your own fields. More than ever, I think it is greatly needed. So again, thank you, and thank you, Dean Galea.
Thank you, Vivian. We'll move on to our second awardee, who's Dr. Khalil Memon. Dr. Memon is the CEO and president of DK Healthcare Services, which is a Chicago-based healthcare agency of nurses, healthcare managers, nurses, and physical and occupational therapists. He also served as executive vice president of Atrium Healthcare Services. Previously, he was the director of patient care services at Maximum Rehabilitation Services. He has held officer positions in his native Pakistan and has done extensive global work in research, training, and management with the World Bank, UNICEF, and NGOs. He has also founded several nonprofit organizations, including the Sukkur Blood Donation Society with his wife Deanna, Blessing Foundation International, which provides medical care services and resources in the United States and Pakistan. Dr. Menon has his MPH in International Health from our school and has a degree from University of Sindh, a bachelor degree in medicine and surgery. So I think Dr. Menon has had engagement in the global health arena, really working both clinically but moving towards public health through the NGO world and through the larger world of the World Bank, UNICEF, and NGOs. And we have an enormous wave of interest in these areas from our students, and I think in many ways Dr. Menon was at the beginning of this wave. Come on up, please.
Thank you very much, Dr. Sandro, and thank you very much, my BU alumni and fellows, my teacher. I just met today one of my teacher. She taught me biostatics during my school time, Dr. Lisa. So basically, you know, I am a professionally doctor. I worked in a different area back in Pakistan. I was a forensic pathologist. Then I moved into the central prison, be a psychologist there. Then work in a World Bank project as a primary and focus on the primary healthcare system. And then I got a scholarship to come to US. And first, 99, I landed in Boston. So when I moved in 99 back to Chicago, I always said to my wife, Boston is my second home. So first home is Pakistan, next my second home is Boston. That Boston gave me a recognition and gave me a School of Public Health to be an activist of the public health. So now I am working in a different area of nonprofit organization back here in US and back Pakistan. Because I saw in back Pakistan, children are dying due to the diarrhea. And adults are dying due to the hepatitis. These two big communicable diseases are killing our community people. So I thought to be work in that project. I'm working in a hepatitis and working in a malnutrition kids and diarrhea and all other projects. Thank you very much, School of Public Health, to recognize me, and I really appreciate it. Thank you, Alumni. Thank you very much.
Our next awardee is Lois Simon. Where is Lois? Oh, there she is. Lois Simon is the president and co-founder of Commonwealth Care Alliance, which is a nationally recognized, consumer-governed, specialized healthcare delivery system where she is responsible for the design, development, and management of the organization's business and program planning. A mission-driven healthcare executive, Lois has held senior leadership roles before at Neighborhood Health Plan as vice president and East Boston Neighborhood Health as chief operating officer. She also previously worked at the Commonwealth of Massachusetts in the Executive Office of Elder Affairs as Assistant Secretary. She was Director of Long-Term Care at the State Medicaid Agency and has been involved in really all aspects of health promotion in Massachusetts throughout her career. She has a degree from UMass Amherst and then an MPH from our school. I think Lois represents sort of the third arm of what our students do, which is why I was so thrilled about our awardees today, with Vivian doing the health innovation that is emerging, Khalil doing the global health, and Lois really doing the foundations of what it is that builds a healthier society here, working both for government as well as for her own community-based organization. Lois.
Thank you, Dean Galea, and all of my colleagues and friends here in the room. This is really a wonderful honor. I'm an old alum of the School of Public Health. We were joking a little bit earlier. I think I may be the oldest alum in the room. Oh, I've got others here. Okay, great. So I was the class of 1983, and when I attended the BU School of Public Health, I attended on a full-time basis, taking classes 4 evenings a week, and I was working full-time days. And that was very much the way that the school operated at that time, and frankly, it was the only way that I was going to be able to go to graduate school on a full-time basis, because I needed to be working. And as the late Dean Norm Scotch convinced me, it was really a wonderful opportunity for me as a non-clinician to find my pathway in healthcare. And I remember looking at various school options for graduate school, and there was a real bias at the time for clinical people going into the world of public health. But I found a home at BU and really discovered an opportunity that really has been, the thread throughout my career, to work in an interdisciplinary fashion, bringing my skills in management, communication, strategy, planning, and imagining into a world of others that were around me as clinicians, building programs for those that really needed a different approach to the way that healthcare is delivered in our country. And it was so many wonderful faculty. I remember Herb Kane actually was the first professor that I ever had in statistics, but in any sort of math-oriented kind of class that actually I could understand its application to something that interested me and that was real and that was going to be useful. Wonderful experiences with Saul Levine and understanding the implications of, stress on health. And I could go on and on. But among the many important people that I met among the faculty has been a longtime mentor and colleague of mine, Bob Master. And together we co-founded Commonwealth Care Alliance 12 years ago. And that's really been the capstone, I think, of both of our careers in being able to transform the way that primary care and care coordination services are delivered to elders and individuals with disabilities in Massachusetts. So I thank you, BU. I thank you, my colleagues and the faculty. Michael, thank you so much for all of your help and helping me to understand this whole award process. I'm humbled and feel very privileged to be receiving it. So thank you.
I just wanted to conclude with 2 quick reminders of why we do what we do. I love the public health community because we truly draw believers, and I consider myself a believer, and I say that as sort of I think a term of pride. But a paper just came out today that shows that we could have had 96,000 fewer deaths in the past 15 years among US white men if our trend of mortality followed that of many other high-income countries. Our mortality among black men is 50% greater than among white men, so you can all do the math as to what that is. That's just domestically. Globally, we have infant mortality rates in sub-Saharan African countries that are roughly 90 times what they are in Massachusetts. And these are all things that are avoidable and preventable. In one of my dean's notes that I do every week, and really, for those of you who are interested, we can add you to the list. And I try to write a dean's note that forces me to reflect on public health, and it really forced me to think about why is it that we're doing what we're doing. I talked about the concept of the fact that we try to make the acceptable unacceptable. We try to say it is not acceptable that 25,000 people die unnecessarily in the United States because we have a quaint notion about firearm laws that does not reflect any reality. It is not acceptable. It is not acceptable that a baby who happens to be born in Ethiopia versus being born in Massachusetts has a 90-fold greater chance of dying just because she happens to be born in sub-Saharan Africa. Those are things that currently in today's world are acceptable, but they should not be. And that's what we are here about. And I think that's what this community is about. It is about a community of scholars, a community of students, a community of practitioners, a community of alumni, a community of staff, all of whom are working towards that ideal. Now, we're not going to get there in our lifetimes, right? But we'll get closer. And the whole point is for us to aspire to a healthier world. And if we can do that together, I think we'll make a world that's better for our children. And that's what we're here to do. And if at the same time we can do it with a good view, so much the better. I want to thank you all for being here. Really, it's really a privilege to serve as Dean of the school. It's a real thrill to be here with you all. And I look forward to seeing you again at our next event very soon. Thank you all.